This is my audience. If you or a loved one had a mental illness and the choice was to take antipsychotic medications, which have multiple negative side effects, or use pet therapy for treatment with no side effects, which would you choose? The National Institute of Mental Health states that working with animals like horses, dogs, or cats can help some people cope with trauma, develop empathy, and increase communication. Companion animals are introduced into psychiatric wards and bring comfort and have a therapeutic effect. Animals are effective in easing behavioral problems and promoting emotional well-being. I'm like you. If one of my family members or myself had a mental illness, I would want the best available help possible with the most minimal negative side effects. Hopefully none of us will be in this situation, but if we are, we should care about the side effects of mental health medications as opposed to the benefits of an alternative choice of therapy with no side effects. The negative side effects of many mental health medications can be so detrimental that an alternative therapy of using animals is a much better approach to manage those same mental health issues. I will begin by showing you the need for change when it comes to the use of mental health drugs. According to the Citizens Commission on Human Rights, the country has seen a reliance on psychiatric medications. They are prescribed for everything from learning and behavioral problems to handling the fears and problems of the elderly and all mental illness in between. Worldwide statistics show that a rapidly increasing percentage of every age group rely heavily and routinely on these drugs in their daily lives. Yes, we all do need to feel mentally secure, safe, and sound, but do we need drugs to help us feel this way? Mental health drugs have multiple side effects, and animal therapy simply does not. Now, I will tell you why we should replace the medications for mental illness with animal therapy instead of medications when we can do that. Using animals, according to MedicineNet, has become part of many types of psychotherapy and crisis response. According to Mental Health Today, benefit of animals to people with mental illness is increasingly being recognized and becoming a more common part of services. Not only dogs, but cats and parrots help people who act out aggressively and have impulse control issues. Critterish All Sorts is an organization with animal-assisted therapy, and they indicate that skunks, lizards, tortoises, and snakes and spiders now go into medium to high secure mental health hospitals and interact with patients that are suffering from anxiety, depression, and paranoid schizophrenia. It reduces the patient's blood pressure and it releases naturally occurring feel-good hormones, and stress and anxiety levels are reduced. These patients become more mentally alert. American psychologist Howard Herzog says, whether and under what circumstances pets make people happier and healthier is unclear. It is, however, clear that animals play a role in nearly every aspect of human psychological and cultural life. So I propose that if and when you might or a loved one might be prescribed any of these mental health medications, please investigate and review the benefits of pet therapy. If pet therapy is an option and one chooses medications before exploring the benefits of animal therapy, some of the side effects of these drugs are devastating and can be worse than the illness itself. So let's review some of the terrible side effects that are noted with some mental health drugs. According to the Citizens Commission on Human Rights, psychotropic drugs may act like they're taking the edge off of anxiety, pain, and stress, but in reality they're actually taking the edge off of life. The pills not only numb the pain, but they numb the entire mind. In a close study, none of the pills can cure and all have horrific side effects, and due to their addictive and psychotropic, which is mind-altering properties, all are capable of ruining a person's life. And mental health nursing states that patients complain of an antipsychotic-induced apathy, emotional indifference, mental fogginess, blankness, and clouding when on these medications. The Journal of Gerontological Nursing says with older adults, the medication can lower the blood pressure greatly and put elderly patients at a much higher risk for falls, skeletal fractures, and confusion. In closing, I would like to say that the use of mental health drugs with their dangerous side effects can be decreased with the use of animal-assisted therapy. Please ensure if you or a loved one is prescribed any of these medications, prior to running out and filling a prescription, you investigate and review the possibility of pet therapy. This could save you and your loved ones from potentially dangerous side effects. For more information, Just Pet and Partners is a local Northern Indiana program helping in local hospitals and other facilities, and they are a part of a national program called Pet Partners. Both can be found on the internet at justpetandpartners.org and petpartners.org. I appreciate your time and hope that you'll consider using pet therapy as opposed to dangerous mental health drugs should the need arise. Thank you, and I hope you appreciated this presentation. Is your pause? This was my audience.